How is a vaginal tightening performed? The most important thing about this procedure is, of course, the enhancement of sexual stimulation. And sexual stimulation has to do with friction. If the friction and the forces are not enough, there will be no stimulation. On the other hand side, if it's too tight, then it hurts. And therefore, we would like to also know about the anatomy of the corresponding partner, the man, the husband. And of course, you have to see what penis size are we speaking about to make it as best fitting as possible. Of course, we make it a little tighter because afterwards it will be loosening a little after surgery, so we make it tighter in the beginning. The vagina is made smaller, the diameter of the vagina is made smaller by taking out a piece of the vagina at the anterior, also on the posterior vaginal wall. Additionally, the remaining vaginal wall is filled up with autologous fat grafting with your own body fat. And the third point, the third step of this procedure is to tighten the pelvic floor muscles that surround the vaginal tube. This is very important for a long-term result. I would like to show you in a little drawing that I will make for you how it works, and afterwards you can follow the whole procedure with a video animation that we made. It's a little more precise. The vagina is a tube. This is the vaginal wall, and here are the pelvic floor muscles. Here is the rectum, and up there is the bladder. So what will we do? Here from the anterior vaginal wall, and also here from the posterior vaginal wall, there's a whole segment removed over the entire length of the vagina. The vaginal wall is then puffed up by injection of your own body fat, and the pelvic floor muscles are approximated to the midline and made more close surrounding of the vagina. So it looks like this. The vagina is smaller from inside, the vaginal wall is thicker, and the pelvic floor muscles surrounding the vagina are tighter and applying pressure on the vagina, which is important for a long-term result. So this is how it is done. The muscles are then tightened here in the midline, and you have a good compression on the vagina from outside. This is like a little drawing, and how it works more precisely we can watch now on an animation.
Vaginal tightening resets the anatomical conditions so that optimal sexual stimulation of the vagina is possible. The main reason for a decline in sexual stimulation is change due to childbearing and aging. The vagina becomes flaccid and widens. The pelvic floor, shown here in red, also loses tension. First, the vaginal tube is narrowed by removing a segment from the anterior and posterior vaginal wall along the entire vaginal length. Then, the endopelvic fascia is tightened, as well as the pelvic floor muscle, which gives the vagina support and additional pressure from the outside. The vaginal wall is plumped up and thickened by injecting the body's own fatty tissue. Compared to the initial situation, the surgery narrows the vagina, thickens the vaginal wall, and raises and firms the pelvic floor muscle.